Hello, I'm Dr. Bob Arnott, and I've been on the front line of epidemic diseases for decades, from cholera during the Rwandan genocide to Ebola in Uganda, as a physician, humanitarian, and network news correspondent for CBS and NBC News. I prepared this course with the best expert advice to help you care for COVID patients at home. Your number one most important job in taking care of COVID patients after protecting yourself and your family from infection is knowing the emergency signs and symptoms of the disease. Why? The most terrifying part of COVID is the speed with which patients descend into complete respiratory failure. A young London doctor told me she had never seen patients fail as suddenly as with COVID. Each day in New York City, hundreds of bodies are pulled out of apartment buildings, all having failed to get care at the right time. In this course, we'll look at how to manage COVID patients at home so you know exactly what to look for and when to quickly get them to high-level expert care, with hope that many more lives may be saved. So the most critical part of taking care of patients at home is knowing when they really start to get into trouble. The usual timeline is 4 to 6 days after the start of symptoms, but don't be misled. This can be as long as 2 weeks, while older, sicker patients may have these symptoms right away at the beginning of their illness. The best way to protect them is to know what to look for. Just like great nurses chart patients' progress every day, you too should write down your observations and look for simple trends. Now let's look at the CDC's warning signs and several from recently published studies. 1. Shortness of breath. As soon as you notice that your patient is short of breath, it's time to begin finding your way to a first-class hospital that still has ICU beds and ventilators. The experience at St. Thomas's Hospital in London was that patients had only 8 to 12 hours from the first feeling of shortness of breath to respiratory failure and the need for a ventilator. Many who didn't make it likely became short of breath, but then relaxed, looked fairly peaceful, and then died at home. The shortness of breath is most often the beginning of acute respiratory distress syndrome, which may lead to complete respiratory failure. This may also be a sign of pneumonia. 91% of COVID patients in China had pneumonia. Once you're at the hospital, the nurses will check your patient's oxygen saturation. If this is above 90, you may be sent home. If it's below 90, your patient will likely be admitted. In the home medical kit section, we'll show you an oxygen monitor as well. 2. Persistent pain or pressure in the chest. A surprising number of COVID patients may suffer a heart attack or an inflammation of the heart called myocarditis. Both increase the likelihood of death. You want to be seen as early as possible for either of these symptoms so the doctors can begin immediate therapeutic interventions. 3. New confusion or inability to arouse. There are new reports of neurologic symptoms with severe COVID-19. However, the inability to arouse your patient is incredibly important for you to detect severe COVID patients because they have this precipitous drop in their oxygen in their blood and may be hard to arouse and then die quickly. This may be the single most important thing to be aware of at home. Again, to emphasize how many thousands of patients worldwide die at home. If this could be prevented and all these patients reach hospital early enough, many, many more lives might be saved. This is your number one first and foremost job. Look for shortness of breath and inability to arouse. Number 4, bluish lips or face. A key sign of not enough oxygen in the blood is that your patient's lips may turn blue or their face turns blue. A unique feature of COVID is this fast drop in blood oxygen levels. You might see first shortness of breath. That's where you want to swing into action. Call an ambulance and get to the hospital. If you wait longer, you may notice the bluish lips or face or an inability to arouse. With an older patient, they may not complain of shortness of breath at all, but just become slowly more somnolent and die. 5. Prolonged fever. The duration of fever in patients was 10 days in a study of patients in China. However, those who were transferred to an ICU had significantly longer duration of fever, as long as 31 days after the onset of symptoms, versus 9 days with less severe cases. 6. Respiratory rate. This is how many times a minute you breathe in and out. New research shows this increases even before other symptoms. As patients get increasingly short of breath, this rate will change 15 beats a minute to 30 and is a clear sign of impending respiratory distress or failure.